How to prepare for an EEG test for epilepsy. Getting ready for an EEG test can seem a bit overwhelming, but knowing what to do makes the process smoother and helps ensure the results are accurate. An EEG, or electroencephalogram, records the brain's electrical activity and is a key tool in diagnosing epilepsy and seizures. To prepare properly, start with your hair. Wash it thoroughly the night before or the morning of the test. Clean hair free of oils, lotions, or hair products like gels, sprays, or conditioners is essential because these can interfere with attaching the electrodes and getting clear signals. Avoid heavy styling or tight braids that might make electrode placement difficult, but light hairstyles like loose braids are usually fine. Keep taking your usual medications unless your doctor advises otherwise. Do not stop anti-epileptic drugs on your own, as this could trigger seizures and affect the test results. If you're unsure, check with your healthcare provider beforehand. Eat a normal meal before the appointment and avoid caffeine and chocolate for at least 24 hours before the test. These substances can influence brain activity and potentially alter the EEG readings. Staying hydrated is fine, but avoid alcohol, which can also interfere with the results. Sleep is a crucial part of preparation. Sleep deprivation is often recommended because it can increase the chance of detecting abnormal brain activity during the test. For adults, this might mean limiting sleep the night before, but always follow your doctor's specific instructions. For children, the guidelines vary by age. Children under 2 should stay awake for about 4 hours before the test. Children between 2 and 5 should go to bed a little later and wake up earlier, avoiding naps. Children over 5 might sleep fewer hours than usual. Remember, sleep deprivation can increase seizure risk, so do this only under medical guidance. Dress comfortably for the appointment. Wear loose clothing and avoid heavy hair products or styles that block electrode contact. If you have long hair, it's best to wash and dry it well before the test. Bring along comfort items like a toy or blanket if your child is nervous. They can help keep them relaxed during the procedure. When you arrive, plan to stay for about 20 to 40 minutes for a routine EEG, but it could take longer if sleep recording or additional testing is involved. The process is painless. The technician will attach small electrodes to your scalp with a conductive paste or gel. You'll need to stay still during the test, which helps get the best quality recordings. During the EEG, you might be asked to do certain actions to stimulate brain activity. These include hyperventilation, which means deep, rapid breathing for a few minutes, or looking at flashing lights if the setup includes photic stimulation. You might also be asked to open and close your eyes repeatedly. These steps help reveal abnormal activity if it exists. After the test, you can usually go back to your normal routine immediately. If sleep deprivation was part of your preparation, you might feel tired or a bit drowsy afterward. So take it easy and avoid driving if you feel unsteady. Following these steps helps your healthcare team get the clearest picture of your brain activity, aiding in accurate diagnosis and treatment planning. Always follow any specific instructions your doctor or EEG technologist gives you, as protocols can vary based on individual needs and the type of EEG being performed. Remember, preparing well not only improves the quality of the test but also keeps you safe and comfortable throughout the process. If you have any doubts or questions, don't hesitate to reach out to your healthcare provider. They're there to help you through every step.